Change your brain, change your life. Welcome to the Ketamine Coaching Academy podcast. Join me, Bronwyn Davis, 25 years as a success coach for high performers and the visionary leader behind Conscious Ketamine Coaching Academy, as I guide you through this groundbreaking approach to healing, personal development, and empowerment. Come for the education, stay for the enlightenment, and leave ready to transform. Hello, and welcome to the Ketamine Coaching Academy podcast. I'm Bronwyn Davis, your host, and I'm here with Ashley Irizarry. Let's take a journey into healing.
Let's do it.
Can you share a pivotal moment in your journey that led you to really integrate ketamine therapy into your functional medicine practice?
In my story, kind of personal and professional realms kind of overlapped. So I actually did my residency during the pandemic, and it was a very stressful time to be practicing, especially as a new doctor. And I experienced a lot of burnout, pretty significant depression as well. And at that point in time, I really started getting into meditation, which was super helpful for me, and also benefited significantly from psychedelic medicine. And my experience with psychedelics is what eventually led me to ketamine. And I had my first experience with ketamine actually was on a retreat, and it was a really powerful experience. And I, at that point, was like, well, I want to incorporate this into our practice, and that's how we ended up offering ketamine at our clinic. Was um, uh, my interest in ketamine and the way that it had so profoundly changed my life. I just knew that I needed to find a way to offer it to patients.
Can you share with us a little bit about what that profound transformation was for you?
I can, yeah. So I mentioned that my first experience with ketamine was on a retreat, and the retreat aspect in and of itself was really helpful. Taking distance from my everyday life, and then the experience I had with ketamine on the retreat, it really helped me to understand where I was not showing up authentically or suppressing my needs to make other people happy or playing small because I was, worried about upsetting somebody or bothering somebody. It just became very, very clear through my journey. And then when I went back to everyday life, I realized I couldn't keep doing the same thing anymore. Once you kind of have that sort of insight, kind of trying to keep going and doing the same thing becomes really uncomfortable. And that experience is what ultimately led me to leave my old job and go all in on our practice.
And I can so relate. My first ketamine session too was so transformative. I saw very similar things, how I was playing small. And you are so right. Like you can't go back. You can't unsee
Exactly.
what you've seen.
Right.
And that's the beautiful part of the medicine as well.
Mm-hmm.
It gives you the
Yeah.
courage to make big, bold steps forward.
Oh, yeah, absolutely. I don't think I would have done it so soon if it weren't for my ketamine experience. In my mind, I actually thought I'll probably just continue to do this like indefinitely. I'll be part-time here, I'll be part-time there. Um, and then I had the ketamine experience and I couldn't do it anymore. I
Yeah.
wasn't ready. I wasn't ready to go all in my own practice, but um, I just felt like I couldn't continue being in environments where I felt like I couldn't be fully myself anymore.
In your practice, you really are working with the entire client, patient. Like it's a holistic approach. Give
Mhm.
us an example of what it looks like when a client or patient comes to you. How do you address all areas?
Typically, so in regards to ketamine therapy, we are usually one approaching ketamine very holistically in the sense that we are trying to really leverage all the mechanisms by which ketamine supports mental health. So, um, the neuroplasticity, the experiential component, and the power of the subjective experience, the integration piece, all of that. And then we're usually combining it with functional medicine. So we're trying to understand if there's any underlying issues that might be aggravating the patient's mental health. We have seen so many patients come through that have undiagnosed conditions, undiagnosed hypothyroidism, vitamin D deficiency, iron deficiency, B12 deficiency, or maybe they need hormonal support, support with menopause or testosterone replacement therapy. And so, ketamine alone is it's really a very effective treatment. And then if you can also work on the other side and work on addressing any underlying conditions, maybe working on um, lifestyle factors, so maybe support with exercise, nutrition, sleep, then you just really amplify the benefits that the patient receives from the therapy, and just help them heal on a more root level. Um, and so that's really kind of how we approach it, is like we don't really view ketamine as just this pharmaceutical treatment. It works on so many different levels, and it, like I said, there's so many mechanisms by which it really helps support a patient's mental health.
Do you start with the therapeutic ketamine and then does it give them inspiration and motivation to work on these other things?
Yeah, it definitely does. I like to ideally do both at the same time. So if they're coming in and they're doing we call it the Becoming series, it combines a functional psychiatric care with ketamine. I like to do the intakes around the same time, the ketamine intake, and that is initiating treatment, and then the functional psychiatric intake around the same time, because if there's anything very clearly abnormal in their labs that we can kind of immediately address to give them a little bit more energy, then I like to try and do that as soon as possible. But with some of the things you're talking about that are kind of more lifestyle changes, the exercise, nutrition, a lot of times we see that those changes are a little bit easier to make once they have at least a couple of treatments under their belt. So, absolutely, I see that they um, have a lot more motivation to make those changes and do some of the things that they know would just help them feel better overall, with ketamine on board, for sure.
Share with me, what are you seeing in your patients? How soon are they seeing results? What are they excited about after being with you?
One of the first things I hear is patients just expressing hope. Um, I hear a lot from patients like, wow, I've never had these many labs done. No one's ever looked at this. And then when we do their labs, just having answers for why they don't feel their best, patients will say things like, wow, this is really validating. Um, you know, like I'll look at the labs and I'll say, like, of course you're tired. Of course you don't want to get out of bed. And so I think patients feel really hopeful. And then in terms of benefits, I mean, I would say pretty early on, between ketamine and maybe addressing any underlying issues, patients are often noticing like more energy, more motivation, um, finding that they can like tackle things that they just haven't been able to deal with for a really long time, finding themselves engaging in activities that they used to love, and then they just, stopped enjoying because they were experiencing depression, or another condition. But those are some of the things I commonly see.
I know you and I are preaching to the choir when we talk about integration.
Yeah.
It is the most important part is the integration.
Hmm.
Share with us how you in your practice value integration and how is it demonstrated in your practice?
Yeah, we both agree integration is really, really important, and it is so crucial for patients getting more out of this medicine. The way that I explain to patients the importance of integration is we'll talk about, the potential experiences they can have during a ketamine journey, right? And so um, I'll say to patients, like, you can have this incredible, illuminating, um, declarative experience. But if you do absolutely nothing with it, then it's just a cool experience, not a transformative one. And usually that like really clicks for patients. Um, it's really about what you do after. And so we include integration in all of our um, ketamine treatment series. And I always say to patients too, you can't overdo integration. So if you want to do more integrating with your therapist, that's great. And so we include that integration. And then I also, at the end of ketamine treatment series, I'll mention to patients like this is just kind of the closure of one part of your journey, right? Yes, we're done with the ketamine treatments, but this is now kind of this jumping off point where it might be time to, if they're not already working with a counselor, start working with a counselor. There's still so much growth that can continue to happen from here. So we are constantly counseling patients around like the importance of integration. Some are more open to it than others. Um, but yeah, we're kind of talking to them about it at every point along the way.
It's so important. I like to say it's 90% of the experience.
Hmm.
10% is the ketamine, and then really taking what our clients and patients find during that journey, and 90% is just really anchoring it in.
Exactly.
That's where change really happens. When someone comes to you, what's kind of a common challenge? Why would they seek you out and your practice?
I think that the patients who come to us because they are looking for a more supportive environment that's a little bit more holistically oriented. Um, and I think that the patients who do choose our clinic over another clinic, I would imagine that the integration piece is one part of it. Um, but some of the challenges that come up, um, there are many challenges that can come up along the way, and this is where the integration appointments are really helpful because we have the opportunity to talk about the challenges that are coming up, and um, oftentimes normalize them. Because over the years, I've seen themes as far as challenges go. But to name a few, I would say one challenge is um, patients thinking that each journey is going to kind of be the same way. And so they have their first journey, and then they have the expectation that the next journey is going to be exactly the same, even though we're constantly, kind of counseling them like every journey can be so different. And that can be kind of challenging because if they have a first journey that's like really light and positive, and then the next journey is a little bit more challenging, that can feel discouraging. So we have to do a lot of counseling around, that each session can be so different. They're all playing a certain role in their healing. Um, and so frequent counseling around that is really helpful. Another challenge I would say is just that patients sometimes can feel a little bit like emotionally raw after treatment, and they might feel more sensitive, sometimes like a little bit irritable, and that can be totally normal. So usually patients just need some reassurance that that is quite common and normal and will pass. I will hear patients express that maybe somebody in their life, a friend, a loved one, maybe either was not supportive of their decision to pursue ketamine therapy, or maybe they tried to share their journey with someone who really just couldn't quite understand the experience or kind of hold space for them in that moment. And that's where sometimes we have to have conversations around kind of maybe being a little bit discerning in who we share it with, not because it's anything to be ashamed of, but it's a very special, powerful, transformative treatment. And there are going to be people in our life that are going to be really understanding, encouraging, and we really want to lean into those relationships rather than maybe the people who don't have as much understanding around it, who might be a little bit more critical or just not unsure of maybe how to support the patient. So those are some of the most common challenges that I see. That, I mean, there are many that can come up, but all of them can be like navigated. And I think when you have a good guide, somebody who is specialized in integration, somebody who has seen a lot of people go through this treatment, then that person can really give you that context of these are all kind of normal things that happen along the way.
I love that. That's so important for us to normalize all of it, all parts
Mhm.
of it, even the
Exactly.
mental health part. I believe our work too is doing that. We're educating people and not keeping mental health like under the carpet, like
Yeah.
we're speaking out about it, that it's okay. It's
Mhm.
okay to not only seek alternative therapy, but even when you're in the therapy, to know it all belongs.
Yeah, absolutely. And I think that one of the beautiful things that I see, though, is that when patients are sharing their experience with people that they do feel safe with, loved ones, um, so like spouses, family members, friends, how often that opens up the conversation, and maybe that person in their life has been struggling and then starts to get curious about ketamine therapy and whether it would be a good treatment option for them. So I've had a lot of patients over the years where they come in for therapy, ketamine therapy, they do really well with the treatment, and then their partner ends up coming in or a family member ends up coming in. So that's really cool to see. Yeah.
I love that as well with my clients, when I work with one and then, right behind them is another one. And it's
Hmm.
just so cool to see how this isn't about just the one person, it's the
Right.
ripple effect out
Hmm.
into their life and the ones they're living with, or, family, friends, and how it impacts every area of their life.
Yeah, absolutely. Not just in speaking to the patient getting help and then it encourages somebody else in their life to seek help, but the positive impact it has on those around them in terms of their relationships. And I hear so often from my patients, they'll say things like, since I started doing ketamine, I am showing up as a much better partner, husband, wife, coworker. I mean, and that's the beautiful thing, like you said, the ripple effect it has on their relationships and on their communities. Yeah.
We are healing our world one person at a time, and I love it. I love it. Well, I'm here with Dr. Ashley Irizarry. We are going to take a break for a moment and then come back. But I just really want to thank you so much for being here, Dr. Ashley. I love this conversation with you, and I know we're going to continue to go even deeper as we move forward.
Me too. Looking forward to it.
Calling all medical professionals, health and wellness practitioners, and coaches. Are you looking to revolutionize your practice? I'm Bronwyn Davis, founder of the Conscious Ketamine Coaching Academy. Our certification program offers a science backed approach, blending innovative coaching techniques with ketamine coaching breakthroughs. Elevate your practice and deliver the fast, deep transformation your clients seek. Join us and redefine what's possible. Click the link below to learn more. Welcome back. I'm here with Dr. Ashley Irizarry, co-founder of New Wave Medicine in Seattle, Washington. I am super excited. This conversation is really taking us deep into what the ketamine experience is for Ashley and her practice, as well as her patients. And Ashley, one of the things that I know you are focusing on is the group therapy, ketamine therapy, like doing it in retreat style. Share
Mhm.
with us more about what that looks like in your practice and why it's so important.
Yeah, so we offer both group treatments in office, and those are usually 3 to 5 people. And then we also offer the retreats several times per year. And I shared earlier, my experience on a ketamine therapy retreat was very impactful, very powerful. And that is what led me to offer the retreats at New Wave. So we've offered now, I want to say 5 retreats. And we started off, they were women's ketamine therapy retreats. And then actually, this October, we're going to be offering our first co ed retreat. And that happened because we had done 4 or 5 women's therapy retreats. And um, so a lot of the people who come on our retreats are patients. And so the female patients would come on the retreats and then they'd go home and they'd tell their partners, how great the retreat was. And so some of our male patients started saying, well, we want to retreat too. So we're going to be offering our first co-ed retreat in October. But the retreats are really amazing, really special to me. I would say it's probably one of the things I love doing the most at our clinic. I look forward to them all year. Um, and they're special for a lot of reasons. The community piece is amazing. Over the years, we've had so many of our patients who come on the retreats form friendships and they're still in touch. And I think it's also just really special being with like-minded people because I think it takes a certain um, level of openness to experience this medicine. And so I think that patients really appreciate that connection, that community component. And then also, like I mentioned before, for me, it was really helpful taking distance from my everyday life, right, with my experience on the retreat. And so I think that attendees really get powerful perspective stepping away from everyday life. Um, and sometimes, too, it's contrast that can be really helpful. If maybe maybe their lifestyle hasn't been very healthy, and then they step into this retreat setting, this very supportive space that's very nourishing. Sometimes that contrast can be really helpful for people. So the distance, the perspective is really helpful. Um, and then it's just really beautiful doing this work in community and in groups. And one of the things that I see with group treatments is that the sharing and integration after can be so, so powerful in terms of, um, patients relating to each other. That's really powerful, feeling like less alone in their experience, but also when they are sharing their experiences. Listening to what others are experiencing can also be really enriching. So the integration that happens on the retreats is very rich.
Do you do it in a way that it, that you feel that the group will complement each other?
It's a great question. So uh, before patients can sign up for the retreat, they have to do a consult with myself or one of the other doctors on the team, and we are screening them, making sure that there's no medical contraindications, but we're also finding out what their goals are and making sure that um, they are suited for the retreat. The interesting thing is that over the years, I've had a lot of different people sign up for the retreats. We've had people actually come from far. I've never met them because sometimes I know the attendees. Sometimes they're patients that I know really, really well. And sometimes I don't know them. I've just had the consult with them and that's it. But the amazing thing is that up until now, it always works out that the groups just bond and connect really well. And so I also, the screening is important, but I also just really trust the process and the container, um, and I just find that the group always comes together.
How many people are on your retreats? Do you cap it at a certain number?
The number has varied over the years. It could be anywhere between 5 to 10. I would say the main, one of the biggest factors in terms of where we max out is just the size of the venue because we have a good amount of people on our team that can come with and assist with treatments. So yeah, small on the smaller side, five. Our upcoming retreat in October, we have 10, and that one was sold out by the early bird date. And it was really just we didn't have any more we didn't have any more beds. We would love to have had more people come, and we did have additional interest. But yeah, so far the limiting factor has really just been the size of the venue.
What do you do on your retreat as far as to provide that safe container? What are some of the practices that you use?
The first evening is really about arriving and beginning to connect with the group and forming that safe container. And so we do some introductions. When there are repeat attendees, which there often are, actually have in our October retreat, I have two patients where this is their third retreat with us. So usually I'll ask them to just share a little bit about their experience on our retreats, and I find that that's really helpful. Or if there have been, if there are patients that are um, new to ketamine, or excuse me, if they have experienced ketamine, I'll also ask them to share a little bit about their experience because very often as well, we have patients who are brand new to ketamine attending the retreat. And so I think that hearing from either people who have been on the retreats before, who have experienced ketamine before, can be really comforting, reassuring. So we usually have some sharing, and then we actually do a lozenge treatment on the first night that is really just kind of focused on connecting. Arriving is something we really focus on too, that first night as well, of really starting to disconnect from responsibilities and trying to just really be there at the retreat and orienting to themselves and taking advantage of the time and space to tune in and do their healing work.
What do you notice, especially like in that first night,
Mhm.
with them starting to go from the outside world now into their inside world?
So I think sometimes the first evening, people are sometimes shy, sometimes a little apprehensive. Sometimes they're still just trying to like disconnect and fully be there. And then we'll have the lozenge treatment. People are usually a little bit more relaxed, but it's always just remarkable when they wake up the next day after that initial lozenge treatment. And everyone is a lot more kind of outgoing. They're starting to open up. It's definitely a gradual unfolding, but usually it's like the first night, people sometimes arrive tired, like tired. Like I said, they're trying to disconnect. Some people a little bit more shy, and then wake up in the morning, and a lot of times they're perked up and they're excited. And then just over the course of the weekend, between the activities that we do, the additional treatments, then you start to see people connecting more with each other, people starting to share, starting to go deeper in their sharing. So it's just this gradual unfolding, and it's really cool to see. And for me as a facilitator, again, it's always just like it's always a matter of trusting the process and trusting the container. And even though we've done it many times, there'll always be like maybe one point where I'm like maybe like worried because someone seems really shy and hasn't come out of their shell yet, or whatever it might be. But it always unfolds the same way that by the end of the weekend, there's been some really strong connections formed. Even the most shy person is opening up and sharing. So I always just have to remind myself to just trust the process.
What are some of the things that you offer to them so that they have that holistic experience?
So we do a lot of different workshops. I try and keep it fresh and mix it up every time. Like I said, I now have some attendees where this is their third retreat with us. So I definitely want to keep it interesting for them. But we'll have different workshops. Last retreat, we had team making workshops. We had um, sometimes we'll have treatments. I have a friend who's an acupuncturist, and she'll sometimes come on the retreats and do treatments, and she'll actually um, gear the treatments towards opening them up to their intentions. So sometimes there is body work, workshops, like I said, a variety. We actually did in this most recent retreat, and I got this idea from you. We did the anointing oils. So um, the second day of the retreat, they made anointing oils, and then they were able to use it for the next two treatments. Um, we've had workshops on manifestation. Um, we made bath salts, sometimes just kind of health workshops. My friend who's an acupuncturist, she did one um, on traditional Chinese medicine. So it just varies every time, and sometimes it depends on who I come in contact with that maybe has a skill they want to share. In fact, actually, one workshop, one of the attendees was an artist, and she did a watercolor workshop and was um, showing the attendees kind of how to use art for integration. So it really just depends, but there's lots of great activities that help the attendees connect further. We also will do like foot baths, which are kind of fun spa treatment, and the attendees usually really like that as well. So
That sounds so great. I want to come. That's exciting. Good for you. That
thank you.
is so cool. What do you see as the vision for the future of therapeutic ketamine? What do you see big picture?
That's a big question. Um, I mean, similar to you, I think I see ketamine being used more for mental wellness. Ketamine is certainly a very powerful tool for people who have diagnosed mental health conditions, especially patients who have been labeled treatment resistant depression. I mean, it could be an amazing tool. Um, those patients, they might not have responded to antidepressants, TMS, and they respond to ketamine. And I can't tell you how many patients have come to us and in the beginning of treatment, they're suicidal. And by the end of treatment, they're thriving. And so I think ketamine will definitely continue to be a powerful treatment option for those patients. But as you and I know, ketamine can also be really helpful for um, people who maybe are not experiencing a mental health condition, but maybe are working through some things, whether it is a big life transition, um, divorce, retirement, or maybe they're like rethinking where they want to go with their life. Um, and also just as a tool for inner growth, um, kind of living up to your full potential, helping to work through any blocks to doing so. Um, so I think that we'll probably see ketamine being used more in those sort of situations.
You're right. I mean, we're just getting started here. We're just getting started in
Hmm.
the mental wellness revolution and really focusing on um, those who are ready to go to that next level or make it, transform through life experiences, like you
Hmm.
said, divorce, could be empty nester, new job,
Big one
loss
too,
of
yeah.
job, all of those things.
Right.
It's really very it's just a very healing medicine to
To
help my
help.
clients, and I'm sure yours too, get
Right.
over that,
Hmm.
whatever it is, that hump, to help them know that they're okay. They're
Hmm.
okay.
Right.
They're gonna make it through.
Exactly. And you don't need to have a diagnosed mental health condition to need reassurance or to do some healing work. So again, there's a lot of people who could benefit that are trying to work through things, process things, but they're not in that category of having a mental health condition, but would benefit immensely.
I am so honored that you are a certified conscious ketamine coach through the Conscious Ketamine Coaching Academy. You have taken what you have learned in the academy and really made it your own. And that's the point of why I created the academy, is to provide this platform. It's a full from start to finish, you get everything you need. But most importantly, you get to take everything you need and make it your own so that it fits into your practice. Share with us a little bit about what the training did for you and how it helped you just even have more confidence to offer ketamine coaching.
What I loved about the academy was getting to connect with other ketamine practitioners, um, and hear what they're doing. This is kind of a new frontier, and everyone is offering ketamine in slightly different ways. And sometimes, too, as clinicians, we can at times feel a little bit isolated in our work. And so it's been really helpful to connect with other practitioners, um, have a sense of community in that regard, hear what other people are doing and how other people are innovating in this field. So that was for me really, really valuable. And then the coaching piece, um, I it's definitely given me more confidence in that regard. And I did have some training and coaching before, but I don't know if I would have known how to integrate it into um, ketamine therapy. And so the your protocol is it's very clear how to do so, and um, provides a very kind of clear roadmap in that regard. And so, like you said, everybody's practice is different, and it's really about integrating what you learn into your practice in a way that works for you. And so, with my practice, I was already offering ketamine and had some very well established protocols already, didn't really have the capacity to offer the ketamine coaching in exactly the way that we learned in the academy, but I was able to take parts of it and incorporate it into what I was already doing, which has worked really well for me. And that's what I'm doing with the Becoming series is I'm working coaching into it at the end of the treatment series.
I love it. I love it. That's exactly how and why I was envisioning the process, and what I'm training on is so that every student can take it, own it, and make it their own. That to me brings me so much joy. So I'm
Yeah.
so glad to hear that you are really maximizing that opportunity. What would you say for you was the biggest breakthrough or biggest shift as you went through the academy?
There were a lot of shifts that happened, so it's kind of hard to pick just one. But I think it it got me out of my shell quite a bit. I would say that was probably the biggest shift of um, helping me get out of my shell in many ways in terms of starting to connect with other providers, um, as well as just having the confidence to do things like this, go on podcasts or show up on social media or do presentations. I've done a lot of that since the academy. And so I would say that was probably the biggest shift for me. I wasn't necessarily a shy person before, um, but I wasn't necessarily doing these sort of things before either. So I've been getting out of my comfort zone um, since doing the training.
How do people find you? Let's talk about, because you're amazing, Ashley, and I want
Thank you.
everyone to know about you. And whether it is a retreat, whether it's your website, share with us how people can work with you.
Yeah. So heading to our website, New Wave Medicine's website, it's newwavewa.com. And there they can find information about ketamine therapy, whether they're interested in individual treatments, group treatments, retreats. Um, and then they can follow me on Instagram, dr.ashley.irizarry, or they can follow the clinic, and that handle is New Wave Med. Yeah.
Ashley is coming to Arizona, everyone. So I am super stoked being here in Scottsdale, Arizona. I
Yeah.
am so happy that you are coming here and even as a prescriber,
Hmm.
you have a lot to offer us here. So
Yeah.
share with us more about that decision to come here.
Yeah. So my first experience with ketamine was actually on a ketamine therapy retreat in Sedona. So I've always kind of had that dream of doing ketamine therapy retreats there because Sedona is so beautiful. The energy there is so amazing. And then Arizona just has a special place in my heart because I have a lot of family there, and I've been going to the Phoenix area every year, sometimes more than once a year for the last 20 plus years. So Arizona is kind of like a second home to me. And now I have a lot of great professional connections down in Arizona, which is really exciting. People I can collaborate with from the academy, different ketamine practitioners that are combining ketamine with different modalities. So I'm really excited just about all the potential collaborations, possibilities down in Arizona. So I do see us probably doing a ketamine retreat in Arizona in early 2026. And so that's big. And then I am doing some writing on ketamine and hoping to share more about ketamine therapy in written form as well.
We are so excited. I cannot wait. I cannot wait for the book, for more retreats, for you to come here, all of it. Ashley, thank you so much for being here
Of
today.
course.
I'm so thrilled for you and where this has taken you. You are an inspiration and I'm super excited to introduce you to all the people who are listening. And so thank you so much for being here.
Thank you. It's been fun.